Hi, I'm Bobby Peer with TAPinto, and I'm here with Dr. Anthony Terrana from Terrana Orthodontics. Welcome back, Dr. Terrana.
Hi, Bobby. Hope everything's well.
It's going great. We're in
Good.
2022
Good.
and it's a new year. So
Yeah.
I'm
Yeah.
looking forward to a better year. But last time we spoke, you just opened your office in New
Yep.
Providence and
Yes.
you told us all about your special equipment and
hmm
your really state of the art. Today,
hmm
I'd like to talk about when should we start thinking about bringing our kids or ourselves? I mean, that's a different
hmm
topic, but when should we start thinking about bringing our children to your office to get
hmm
checked out?
So that's a question I commonly get amongst parents. Most people think of teenagers and preteens as the age group to get braces and orthodontic treatment. However, the American Association of Orthodontics actually recommends bringing your kid in at age 7 to get checked. So
Oh,
most of the time, at age 7, there's nothing we need to do. We monitor them, we observe them until they're ready, but there are certain things we check for that can't be seen that have to be seen by an orthodontist. So usually we take x-rays and we want to see how all the permanent teeth are erupting. One of the common problems we see typically is small jaws, upper and lower, and these small jaws can lead to issues later on. If the jaw is too small, there's not enough room for all the teeth to come in, and in that instance, we usually have to take out, if we wait too long, we have to take out 4 permanent teeth, right? So by taking out 4 permanent teeth later on in life, that could lead, there's studies that shown that could lead to sleep apnea, breathing issues. So we want to do everything we can to prevent that from occurring. Another thing small jaws could lead to is impacted canines. When a canine's impacted, there's just no room for it to come in on its own, so it starts to deviate as it erupts. And in that case, if the canine's impacted later on, a surgeon has to go and cut away bone, cut away tissue, place a chain on it, and pull it in. So we want to prevent those things. So the best way to prevent them is to come in, see an orthodontist. A lot of times, if we see that occurring based on the x-rays, we could prescribe to put expanders in. Expanders are great at age 7, at age 8, because it's very easy to grow bone at that age. Kids at that age, their growth plates are still growing. So it's a great opportunity to go in and make space by creating space using the expanders. Here, our expanders are 3D printed. So we take a 3D scan of the teeth and that's sent to the lab. The lab will 3D print the bands to fit exactly to those teeth. So they're customized just for the patient's teeth. This allows the expanders to be smaller, more comfortable. When we put them in, we don't have to do separators, which we used to do, where we'd have to wedge basically elastics between your teeth for 2 weeks. It caused a lot of pain in children. So here we don't have to do that. By not having bands, we also don't have to wedge the bands in between the teeth, which also causes discomfort. And by having bands that perfectly conform to your teeth, it's much more hygienic and easy to clean for the children. So it doesn't lead to any irritation, gingivitis. So these 3D printed expanders are a great opportunity to grow bone and allow teeth to come in that if we didn't later on, by the time they're age 12, 13, when all their permanent teeth are in, now it's too late. Now we have to send to a surgeon to either expose tissue, expose teeth, or take teeth out. So I think it's a great opportunity to be checked at an early age to prevent those things. Now, I'm not saying everyone needs an expander. Maybe 20% of the children that are coming in need it, and we only prescribe it if it's absolutely necessary.
Okay, and so once you see a child and you get these x-rays and
Mm-hmm.
the molds and models,
Yeah.
how often do you need to see the children?
So typically we'll come in for our consultation. If parents want to get started that day, I know people are very, very busy. We scan them that day with our 3D scanner. It takes about 5 minutes. That gets sent to the lab. They send it back to us. We place the expander in. Usually in the beginning, we want to check the kid every 2 to 4 weeks to make sure expansion is going well, everything's okay. Then after that, we see them about every 6 weeks to just align their front teeth and get the spaces closed and move the space to the back where we need it, especially in the canine region to prevent them from coming in on angles and damaging
Okay.
adjacent teeth.
So are dentists in line with
Mhm.
recommending this as well?
Some dentists are aware. It's something us as orthodontists need to just explain more to dentists so they do know at what age to recommend children. We're trying our best right now just to promote, having kids age 7 seeing an orthodontist. So that is the age the American Association of Orthodontists always recommends to be seen. The reason why at age 7, that's when you first start having your permanent incisors starting to erupt. So we can see how they're coming in. We want to make sure they're coming in properly. The molars are in. So now we can get a better idea on how growth is going to occur, if they're going to have good growth or bad growth around age 7, age 8.
This is great information. Thank you so much. And I look
Thanks,
forward
Bobby.
to future conversations.
Yes. Take care, Bobby. I appreciate this conversation.